We're now live. You can go ahead.
Good afternoon, everybody. And thanks for joining us today. I'm Chris Corsi, a member of the County Board of Supervisors for the 3rd District. And this is our COVID-19 update for Wednesday, October 13th. We'll begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert.
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Supervisor Corsi.
Gracias, Gilbert. We'll start with just a couple of quick updates. We continue to get more shots into the arms of our residents, protecting them and our community against COVID-19. We've now administered more than 700,000 vaccine doses in Sonoma County. That brings us up to 78% of the eligible population fully vaccinated, and another 7% who've received the first dose. That means only about 15% of eligible residents have not received any vaccine yet. While our case rate continues to decline, there's no doubt we could get it down sooner, faster, if more people were vaccinated. The case rate among unvaccinated is now 16 new cases per 100,000 people each day. While it's just 4 new cases per day per 100,000 among people who are fully vaccinated. That math shows that those who have not been vaccinated continue to get sick at 4 times the rate of those who are vaccinated. People who are unvaccinated have worse symptoms. They end up in the hospital more often, and they die at a greater rate than those who are vaccinated. That's why people are calling this a pandemic of the unvaccinated. At this point in the pandemic, these extreme outcomes are entirely avoidable. We have the tools to end COVID. We just need everyone who is eligible to go and use those tools, get vaccinated. The vaccine is safe, it's effective, and it's free and widely available to anyone who wants it. We're hearing questions these days about vaccines for younger children, and we'll answer some of those questions and more during the course of this briefing. At this point, I'd like to introduce Dr. Sundari Mace, Sonoma County's health officer, for more on the state of the pandemic. Dr. Mace.
Great, thank you so much, Supervisor Corsi. Our case rate is continuing to decline, which is a positive sign that the measures we have taken are working. Our overall testing positivity rate is now 2.1%, and our combined vaccinated and unvaccinated case rate is down to 8.2 cases per day per 100,000 residents. This is much lower than the 34 new cases per day that we were seeing at the height of the Delta surge in mid-August. In fact, the last time that our case rate was this low was July 15th. So we're going in the right direction. However, I want to remind people that our case rate was down to 2 in April. So we have a ways to go before we can say that we have this surge under control. We know that many people have questions about Governor Newsom's announcement that all students will require a COVID shot to attend in-person classes. This is not an immediate mandate. It will take effect only after the Food and Drug Administration fully approves the COVID vaccine for school-aged children. Right now, only the Pfizer vaccine has been fully approved for individuals 16 and older. For those ages 12 to 15, the vaccine is under emergency use authorization. So if the vaccine is fully approved for that age group, that is 12 to 15, by the end of the year, then the vaccine mandate would take effect in January. However, the FDA likely won't fully approve the vaccine until next year, meaning that the vaccine mandate would take effect would take effect for the school year starting next fall, but not in January. Then there's the question of vaccines for children 5 to 11. An FDA panel is meeting October 26th to consider emergency use authorization for the Pfizer vaccine for children in the 5 to 11 age group. That means that approval could come around Halloween, making this group of children, which is about 37,000 in Sonoma County, eligible to get vaccinated this fall. We have been in talks with the Sonoma County Office of Education about helping set up vaccine clinics at schools and about a campaign to educate parents about pediatric vaccines. For most people, though, the primary source of information and to obtain a vaccination for a child will be through their trusted pediatrician. Joining us today is Casey D'Angelo, a former school superintendent and the Sonoma County Office of Education's vaccine chief. We also have Dr. Ari Hauptman, a pediatrician from Kaiser, who's available to answer any questions about pediatric vaccines. I will let Casey share more about the Office of Education's outreach plans. But first, I want to give some guidance for gathering safely this Halloween. As you recall, last year we discouraged door-to-door trick-or-treating because our case rate was high and climbing, and we had no vaccines to help combat COVID. Well, this year we do. And as Dr. Fauci mentioned earlier this week, we believe that it's safe to do outdoor trick-or-treating for Halloween and take part in outdoor Dia de los Muertos activities this year. But trick-or-treaters should avoid large groups and should wear a mask that covers their mouth and nose. Before eating any treats, people should wash their hands or disinfect with sanitizer. Indoor gatherings of unvaccinated people, including children, should be avoided. If you're sick or concerned that you've been exposed to COVID, stay home. People greeting trick-or-treaters at the doorstep should wear masks while distributing candy. Instead of inviting children to reach into a communal candy bowl, consider handing out individually wrapped treats or placing them on a table. Do not distribute candy if you're sick or have been exposed to the coronavirus. As more people get vaccinated, we do hope to return to more of a sense of normalcy and start to enjoy holidays that we missed last year. But we also need to do so safely with the virus still circulating in the community. As I noted, our case rate is still 8, and we'd like to see that come down to where we were in April, to a case rate of 2 or lower. Finally, I'd like to clarify the criteria that my fellow Bay Area health officers and I announced last week for lifting the indoor mask mandate. We will lift the indoor mask mandate when we can reach 3 key benchmarks. First, we must reach the moderate or yellow COVID-19 transmission tier as defined by the Centers for Disease Control and Prevention and remain there for at least 3 weeks. This is defined by a low case rate and testing positivity rate. This means that Sonoma County's case rate must be between 10 and 15 cases per 100,000 residents each week. We're not there yet. We're currently at 76.87 new weekly cases per 100,000 people, according to CDC. The upper part of this case rate, that is 49 cases per 100,000 each week, roughly correlates to what we used to refer to as 7 cases per day per 100,000 residents per the blueprint that California State had. That kind of gives you an idea of what the correlation is. Second, in terms of the requirements for lifting of the mask mandate, COVID-19 hospitalizations must be low and stable. We are now in discussions with our local hospitals and our emergency department physicians and how we will define low and stable. The third piece of the requirement for lifting the mask mandate is about vaccination. We must have 80% of our total population fully vaccinated with 2 doses of Pfizer or Moderna or 1 dose of J&J, or 8 weeks need to have passed since the COVID-19 vaccine has been authorized for emergency use by federal and state authorities for the 5 to 11-year-old age group. Again, I want to note that's 80% of our total population, not our vaccine eligible population, which is a percentage that we have been sharing to date. So this means that the earliest that the ban would be lifted for either us or other counties in the Bay Area is early January. That is as soon as any change would happen. But the point is that there is an end in sight and some tangible goals are in place that we are working to meet. I do want to say, however, that lifting the mask mandate doesn't mean that people can't choose to wear a mask if they feel that they're at risk or simply that they want to protect themselves from airborne transmission. So that is always going to be the option. Okay, now let's bring in Kate Pack, our lead epidemiologist, who can present some data on where we are in meeting these goals. Kate?
Thank you, Dr. Mays. Share my screen. I just wanted to briefly review the criteria that Dr. Mays just mentioned and look at where Sonoma County currently stands. So the first criteria is to be in the CDC level of community transmission that's in yellow for 3 weeks. So you may be most used to how we've been reporting case rates, which is looking at the number of new cases per day per 100,000. CDC looks at it a little differently. So they look at our weekly case rate. And so you can see their framework here and color scheme. So when we look at the yellow here, you can see this is less than 50 cases per week. So to meet this criteria, Sonoma County would need to have fewer than 50 cases per week per 100,000 population and have test positivity of less than 8%. And we would need to maintain these rates for at least 21 consecutive days. Looking at where Sonoma County is as of today, we are at 71 cases per week per 100,000 and 2% testing positivity. So looking at this scale, we would be in the orange or substantial transmission level. The second criteria is being defined differently by each local county. And this is looking at low and stable hospitalizations. And these are COVID-19 hospitalizations. And you can see that locally, these are starting to trend downwards. But as hospital resources and capacity vary greatly by county, this criteria is being defined locally. And as Dr. Mays mentioned, we're still in the process of discussing this criteria with local hospitals and other healthcare partners. The third criteria has two parts. So there's two possible ways of meeting this criteria. The first option is that we fully vaccinate at least 80% of our total population. So that's everyone aged 0+ in our community. When we look at our current status, we have fully vaccinated 68.3% of our total population. So this means we would need to vaccinate about 58,000 more individuals to reach that 80% benchmark. Our vaccine eligible population will be increasing once 5 to 11-year-olds are eligible. And we know based on census data that there are about 37,000 5 to 11-year-olds. But this means that even if 100% of this age group were fully vaccinated, we would still need about 20,000 more individuals from currently eligible age groups to become fully vaccinated to reach that milestone. The second option is to wait at least 8 weeks after 5 to 11-year-olds become eligible. And as was mentioned earlier, it's anticipated that the earliest this approval would come would be towards the end of October. 8 weeks after this time would be in mid to late December. So that would likely be the earliest that we could meet this criteria. And that is the end of the slideshow.
Okay, now I think we're going to go to Casey, and you had some things you wanted to go over, Casey?
Yes, I did. Were there slides available someone was showing that you have up?
Let me,
They were sent to the office.
yeah, let me cue those up for you, Casey.
Thank you.
Sorry for the delay on this. Okay, here we go.
Sorry, I'm not able to.
Can you see those now? No?
No, not yet. Okay, there we go. Okay, if you can forward the slides then as I go through them. Thank you.
Sure.
Keep going. Okay, so as was mentioned earlier by Dr. Mays, we expect the vaccine to be approved hopefully late October, early November. And our goal at SCO and in the county is to try to use this month of October, early November to encourage families to talk with their pediatricians, hosting bilingual school-based virtual and in-person information sessions, and offering school-based clinics as trusted community sites for vaccination. So that's what we're working on currently, is setting up these meetings. Next slide. Next. So as was mentioned, the trend overall in the county is downwards, and we certainly find that in schools as well. And so we're pleased about that. Next slide. At the elementary level, as you can see, is higher right now than the high school level, and that's because elementary students do not have access to a vaccine yet, and high school students have. They're the 12 to 16 range. So, so we're hopeful that once the vaccines are available for elementary grades, the case outlook at the elementary level will also decrease. Next slide. So right now, the vaccination rates for the 12 to 17 countywide is about 63.3% fully vaccinated, another 7.7 partially vaccinated. It took us about 4 months when it was open to 12 to 17 population to achieve the 70% full or partial vaccination rate. Right, there are nearly 37,000 age-eligible pediatric students in Sonoma County based on public-private school enrollment. Next slide. There was a survey done by the Kaiser Family Foundation. They've been doing surveys during COVID times. And right now they found that 4 in 10 parents of children under 12 say they want to wait and see before getting their child vaccinated for COVID-19. You can see in that bar graph there, 26% say they'll do it right away, 40% are wait and see, 9% only if required, and 25% at the time of the survey said definitely not. So our goal right now is to work on that 26 and the 40%, trying to get as many of those vaccinated as possible. Next slide. Other data that they found in the surveys that Hispanic and Black parents are more likely than white parents to cite issues with access barriers to vaccination, including not being able to get the vaccine from a trusted place, believing they may have to pay out-of-pocket costs, or difficulty traveling to a vaccination site. Parents of 12 to 17-year-olds reported that when they received COVID-19 information at their schools, or were encouraged to get their child vaccinated by their schools, they are more likely to have their child vaccinated. This suggests school outreach can help increase vaccination rates, which is why our focus right now is helping schools spread that information. Pediatricians are a top trusted source of information on COVID-19, but many parents haven't yet spoken to their pediatricians about these vaccines. Next slide. So our goals for the vaccine, next slide, is we're hoping we'll have 25% of the pediatric vaccination rate by December 1, 50% by January 31st, and 70% by the end of February. Families will first be encouraged to be vaccinated through their local pediatrician healthcare provider. Clinics will be offered to those without convenient or affordable access to healthcare providers. And we want to ensure that parents have information, support, resources, and knowledge to make health-based decisions about vaccinating their children, along with easy access to reputable and trusted vaccination sites. Ensure rollout is equitable and addresses barriers to vaccination. Next slide. So what to expect? Our target sites for school-based clinics are going to be areas with recent high case rates, areas with a high number of English learners, areas with lower vaccination rates, and the county's equity team will also seek additional engagement and input from community advocates who represent these communities. Next slide. So our fall outreach activities, what we're currently working on, we will have a joint webinar between SCO and County Health in late October with Dr. Shendy and Dr. Harrington and pediatricians. We'll hold a version in English and one in Spanish. We'll offer a series of similar webinars with pediatricians and local school leaders that are targeted to school communities. We run these October through February. We're actually in the process of setting these up, as it says on the next slide, with ELACs. ELAC is the English Language Advisory Committee, and DLAC is the District English Language Advisory Committee. So we've actually started these in October. First one was yesterday, and they will continue on through the end of this year. SCOAS will develop a bilingual communication packet for school leaders and school staff with materials such as flyers explaining the benefits of vaccination, a short video sharing the same information, a web page with easy to find information on where to get vaccinated, frequently asked questions, and common message talking points. Next slide. So in late September, we had a kickoff meeting with all school districts. In early mid-October, we're holding planning meetings with County Health, identifying clinics and outreach strategies. We're beginning planning meeting webinars with pediatricians. Late October, we'll hold our first joint webinars with the county. Late October, release communication packets to school districts. And early November, we're hoping, is the estimated release of first doses. Next slide. So thank you very much. Are there any questions?
Okay, well, thank you, Casey. We appreciate that. And thank you all for taking part in this great forum. We are going to be taking questions now from our viewers and from our media partners. We want to remind our viewers, those in the public who are watching us via social media, that if they have a question, to go ahead and place it in the comments area or to email us at publicaffairs@sonoma-county.org. That's publicaffairs@sonoma-county.org. And we will get to them. First, let me pose some questions that we have received and that we have for our panelists. And I'm going to start with our guest, Dr. Ari Hoffman from Kaiser, a respected local pediatrician. Dr. Hoffman, obviously, you have been, no doubt, getting a lot of questions about the safety of vaccines, primarily, especially for children. What are some of the most important things that you think parents should know as they decide? As Casey noted, there's quite a number that are kind of taking a wait and see attitude. What do you think is the most important information for them to know, and what are some trusted resources they can rely on for finding good information about the safety of vaccines?
Yeah, thanks for having me, everyone. I get asked about vaccines always, not just the COVID vaccine, all our vaccines that we have. And I think sometimes we take for granted that vaccinations are something that's made it so these diseases are not possible to happen. And even having the luxury of deciding whether a vaccine is safe or not really doesn't answer the question that what we're really trying to do is prevent a disease that can cause death, and of course even more death and hospitalizations and other outcomes. So I think that even with all vaccines, we see these discussions, and with this vaccine in particular, the thing that makes it have more anxiety is that the word that was used when the virus first came out was novel. And I do like to use that word, that this is not just a new disease, this is novel. So that means everything about it is novel. What the disease is doing, how the variants change, what we've seen with surges, how we've had communication from the CDC and elsewhere that sometimes confused people, but it wasn't because it was confusing, it's because the novel nature of this is it's evolving and it is novel. But on the other hand, one thing I like to say about the COVID vaccine is this vaccine has been given to so many people, millions of people. Medical people were really the trusted people to receive the vaccine first. And we trusted the data that came from really great evidence-based studies that showed that there'd be a great immune response and a safe response to the vaccine. And we all willingly took that vaccine. And I think now so many other people around the world have. So the fact that it was given to 12 to 16-year-olds and has been shown to be safe, I think we have seen that happen. And now we're going to see that happen with 5 to 11-year-olds. And this is all based on that it's been given to adults all over the world for so long. And I mean, a long time. We're coming up on a year now almost that the vaccine is being used without effects that have been worried about or have been proposed as possible contraindications. The vaccine, when it comes out for 5 to 11, is going to be a smaller dose, and that is because it has been shown that with the children that their immune response they will have a good antibody response to a smaller dose. And the safety on that and the efficacy, how effective it is, has been shown to be really good. And the question you asked, Paul, about what resources I use as a pediatrician so that I feel comfortable making these recommendations to families. I think all pediatricians will say this, is that the American Academy of Pediatrics, which is the AAP, if you put that in a website search area, the AAP is an incredibly trusted resource of pediatricians. There are no biases to how data and studies are interpreted. And it is an organization that reviews everything that is placed upon families in order to take care of their families and children in a safe way, including COVID and the COVID vaccine. And there's a great website that they have. I'm going to just read it out just so I don't make a mistake on it. It is aap.org, and it is COVID-19 Vaccine Campaign Toolkit. And in that, if you go to that page, parents, if they go to that page, there will be a bunch of windows with videos to watch answering many, many vaccine questions. It's a great source. And I trust the AAP, but I've actually looked at the resources on this page, and they're really great. They speak at a great level to everybody so that there's understanding and acceptance. And then another source is healthychildren.org. And so that's all one word, healthychildren.org. And they also have something similar, which is the science behind the COVID-19 vaccine parent FAQs. So science behind the COVID-19 vaccine parent FAQs. And both those are really valuable sites in terms of getting information that is hopefully very vetted by trusted resources without any biases.
Great. Thank you, Dr. Hauptman. Just again, that's the main website for the American Academy of Pediatrics. That's aap.org, and also healthychildren.org for those who are following. We will be sure to share those resources. Dr. Hauptman, there's also some questions out there about vaccinations for those under the age of 5. We're still not quite at those who are 5 to 11 yet, but we hope to be there by the end of this month, the beginning of November. But what are there vaccines being developed? Will there be a vaccine for those under 5 infants? And do you have any sense of what the timing might be for that? Would they be vulnerable, I guess, is the other question, during the period where there will not be vaccine?
Yeah, as far as I know on that, it's available to me just as it is. I think everyone else, if they just dive into what's going on, it's also, once again, Pfizer is ahead of the other vaccine companies in terms of trials. Pfizer's already submitted quite a bit of data for the 2 to 4 age group. Not as much for the 6-month to 2-year-old age group, but those are the 2 next vaccine groups. But they already feel very confident on their 2 to 4 age group data. I haven't seen more about the 6-month to 2-year age group and what the number of enrollees and data, but the 2 to 4 age group looks similar to the 5 to 11 age group in terms of enrollees, efficacy, and safety.
Okay.
And in terms of when it's coming out, Paul, I did see that the 2 to 4 year age group, they did have a prediction that it would be sometime in early next year, but I haven't seen anything about the 6-month to 2-year-old age group.
Okay, good. Well, that's good. That's good information. Casey, if we go back to you, we do have some questions about, obviously, the schools and Sonoma County Office of Education are going to be key partners in getting these vaccines out to children, particularly those who may not have a primary care physician. Could you, when do you think you might have an idea of where specifically these clinics will be located? And are these going to be only for children, certain children, or will these be open to all the kids in that school or that school district?
Those are good questions, Paul. I believe that by the end of October, we'll have quite a few sites set up. I know we already have 3 set up for West County schools and school districts, and those dates will be announced soon. And they're working at the county level, working at other schools, looking at those areas of needs. They will be open up to anyone in that area. It won't be restricted just to that school, but the focus will be for students in that school, and most likely they'll be held after school, like from 3 to 6 or something like that.
Okay. And we also continue to get some questions too about the governor's laid out the possibility of these mandates taking effect by January even. Is that realistic? Is that something that we're going to see here, or what do you think?
Well, Sonoma County Office of Education's stance is they're really hoping it won't happen in January, because it will take an awful lot of work for schools to have to deal with that data. Right now, they're already overwhelmed dealing with COVID and the testing they need to do. So our hope is that it will be approved sometime in late spring and June, so we can be prepared to start next school year with that mandate in place. But we're hoping not sooner, because it would be overwhelming, I think, staff-wise.
Yeah, it might be overwhelming for parents too, because that's but certainly we want to get children vaccinated as soon as possible. Dr. Mace, maybe you could help, or Kate, maybe you could help address this question. Ronnie poses a question, just given the fact that we are going into flu season, and you have strongly encouraged and put out a health order requiring healthcare workers to get a flu vaccine. Ronnie was just asking, what is the case rate of the standard flu typically during this time of year? Do we have any of that? I know, Kate, you've had that information before. Do you have any of that available?
It's a really good question. I don't know, Kate, if you have a case rate readily available. I just want to note that last year, we had a very tame influenza season in terms of numbers of cases. And that's partially because influenza is also a respiratory disease. And we had a mask mandate. We also had people not congregating. There weren't daycares. There weren't, people visiting the skilled nursing facilities. We had all kinds of things in place that actually helped diminish the influenza case rate last year. Kate, do you have any information on that?
I can try to pull up some of the specifics, but I think tracking case rates for influenza is a little bit more difficult than COVID in some ways, because the ones that come on our radar are those that are hospitalized cases. So we may not know every, instance of influenza that pops up, but I can pull that up. And yes, last year it was very low due to the masking.
Yeah.
But I will put a
Obviously.
response in
Well,
chat.
while
once
you
I
look
get
for that, Kate, I have another question that I'm going to pose that's coming from our readers, our viewers. Marcy asks, Dr. Mays, can you explain why our case rate is higher this year with the vaccine than it was last year without the vaccine? What do you think about that?
Are we talking about COVID?
Yeah, I
or
think we're talking about
influenza?
COVID. Yeah.
Yeah, Kate, I don't think that's actually the case. Our case rate was quite high during the surge last year before the vaccine. Isn't that correct?
Yeah, and I would say part of what we're seeing right now is we're still coming down from Delta, and we didn't have the Delta variant last year. But I will pull those numbers as well. So I'll be following up with two pieces of information.
And I
We're
think
giving
we
you
also
double
need
duty.
to point out that the unvaccinated case rate is incredibly high.
Correct.
The vaccinated case rate is actually 5 times lower. I still think our peak case rate at the surge may have been higher than even the unvaccinated case rate is now, but I'll need Kate to confirm that for me.
Yeah, but I think just to get back to the original point, as we've discussed before, the Delta variant is a whole new beast than what we were dealing with a year ago. And that's even with the vaccine, it just shows the aggressiveness of the Delta variant, as we've discussed in previous briefings. Okay, let me address this one question. We've gotten a couple on this, but Maria asked, can we address the healthy 15-year-old that passed away 2 days after getting the vaccine? Let me, if you'll let me address that one. Yes, it was a very sad case for those who've seen the coverage that has been in our newspaper, local newspaper, and on the radio. This was a heartbreaking case of a 15-year-old boy in our community who passed away. And we just want to be sure that make it clear that this case was thoroughly investigated by the Sonoma County Coroner's Office, as well as the California Department of Public Health and the Centers for Disease Control and Prevention. And forensic experts from all of these agencies looked at all the evidence and concluded that there was no evidence that the vaccine caused the death in this case. The cause of death was determined to be stress cardiomyopathy with perivascular coronary artery inflammation. And they did reference the fact that this came within 48 hours of the vaccination itself, but the only correlation between the vaccination that these experts found, the only correlation between the vaccination and the death was the timing involved, that the death occurred within 48 hours of the second dose. And they all agree that this was a very rare and tragic and complicated case, but that there was no direct link between the death and the vaccine itself. Dr. Mace, did you have anything else you wanted to add about that, or about the safety of the vaccine?
Yeah, just that I want to underline for everybody, this is a tragic death in a young person in our community. Our hearts go out to the family. And as Paul just stated, there was no causation between the vaccine and the death. So I want to let other parents know the vaccine is very safe, effective. It's very rare to have even minor side effects, let alone severe adverse effects. And that everybody should get the vaccine when they become eligible. So right now, if you're 12 and older, or you're a parent of somebody who's 12 to 17, it's time to get vaccinated.
Yeah. Yeah, and as Dr. Hoffman was saying earlier, we've had, I think the number is up to more than 185 million people in this nation have received are fully vaccinated, including 11 million children between the ages of 12 and 17. And I think the overwhelming body of evidence has shown that COVID vaccinations are safe and effective. And as Supervisor Corsi noted, they are free and widely available. And we do encourage people to take advantage of that. Kate, have you been able to dig up that information, or do you need a little more time?
I can address some of it. Looking at our case rates, last September, we were at about 13 new cases per day per 100,000. So we were higher than we currently are in looking at our case rate. And then with influenza, just speaking kind of at the national level, we know that it impacts 5 to 15% of the population each year, and about 30% of those cases are among kids. Here in Sonoma County, there were 13 deaths related to influenza in the 2019 to 20 year. Last year, we had, with the masking, we had very little influenza in the community.
Yeah. Thank you, Kate. Thank you for doing that quick research. We also should note that we recognize we did have just surpassed 400 deaths total since the COVID pandemic began in Sonoma County, and just about all of our recent deaths do involve individuals who unfortunately had the opportunity to be vaccinated but chose not to, and that again underscores the importance of vaccinations. Let's go to our media partners. We have Martin. Let's go to Martin Espinoza from the Press Democrat. Martin.
Can you hear me okay?
You're a little bit, we can hardly hear you, but yes, go ahead.
Okay. My question is for
That's
Dr. Mason and Mr. D'Angelo, who cited this Kaiser Family Foundation study that found that 4 in 10 parents say they want to take a wait and see approach to getting kids under 12, their kids under 12 vaccinated, and only 25% say they would do it right away. Is that troubling? I mean, I think Kate cited, what is it, 37,000 kids in that age category. Is that I don't know if I could get your reaction to that. I don't know if this survey would would stand, if we'd get the same results here in Sonoma County, but I'd imagine this is a national survey.
Casey, go ahead.
Sure. So you're right, it is a national survey. I'm hoping we wouldn't get the same response here, but we don't know that, of course. And I think parents are hesitant, and the 40% who want to wait and see, the wait and see could be once it's approved and they see it's going into kids and it's working, that they may go right along with that. So we're hoping it won't be long, but it is a national survey, so we're not sure what our local parents, where they would stand on the same question.
Dr. Mace, do these numbers concern you, even though they are not national?
No, I'd agree with Casey. I'm hoping that the percentage of parents who want to get their kids vaccinated is higher here. I encourage vaccination. I believe if the FDA approves the vaccine even under emergency use authorization for this age group, then it's been studied in that age group and it's considered safe and effective for use. So I would hope that parents would, if they have concerns, discuss with their pediatrician and go to their trusted partner in the school system to get their kids vaccinated.
Thank you.
Okay, thank you, Martin. Let's go to Aaron Alday. Aaron, you with us?
Hello, hi, can you hear me?
Yes.
Hi,
good to have you.
Good to have you. Good to be here. Thanks for hosting this. I had a question about booster shots and was hoping that you guys could fill me in on what kind of uptake have you had, especially in the 65 and up age group? And are you feeling any sort of sense of urgency and kind of getting uptake, getting boosters out to that age group, just as we head into the fall and winter, and especially with, potentially having the 5 to 11-year-olds coming out, in another month or so. So just wondering if that's a group you're really focusing on now and how that uptake has been going so far.
Yes, that would, thank you, Erin. That would be a priority. That age group is definitely the group that we are wanting to get vaccinated. I'm sorry, get a booster shot, I would say. It's not an urgency, however, because the data shows that those people who are fully vaccinated with the Pfizer vaccine, which is the one for which booster shots are available now, actually have fairly good immunity. We do want to have those over 65 and those persons who are 50 to 64 with underlying medical conditions prioritized for boosters. And the county is working with our partners to reach out to the skilled nursing facilities, the residential care facilities for the elderly, and anybody else in our community in those groups to either get their booster shot through their provider, or if they don't have access to a provider, avail of the services that the county offers.
Do you have data on what uptake has been in that 65 and over age group in particular? What percentage of them have had boosters so far?
Yeah, that's a good question. I'm not sure that the data is complete, but Kate, do we have any data on that? And we don't have our vaccine chief on today to speak to that, but I'm wondering if we have any data, Kate.
Yeah, that's actually something we are going to start posting on our dashboard. We're working on the display for that, but that is going to be something that can be tracked, and we will be noting the number of individuals that have boosters and the percentage of those eligible that are over 65 that have received booster shots. I don't have the most current data in front of me, but as of what I was looking at, I think it may have been a week or more old, so don't put too much stock in it. But at that time, it had looked like over 6,000 individuals had received boosters, and over 4,000 of those were in the 65 plus age group, but that's older data. So as I said, we are tracking that, and we will be posting that data soon on our vaccine dashboard.
Thank you very much.
Dr. Mace, I'm going to pose this question to you. I know that one of the criteria that we have in order to reach the point where we can lift the mask mandate under the guidance you put out last week was that our hospitalizations will be low and stable. What are your thoughts on what is going to be defined as low and stable, and what are you doing to try to help define that?
Yeah, great question. We are working with our hospital partners and our other healthcare partners, the federally qualified health centers, talking with our emergency department physicians to try to understand what low and stable means for the hospitals. In other words, this criteria is here and have been put forth to ensure that our hospital system is not overwhelmed. So that would require our hospitals to let us know how they're doing. And it's not just COVID patients who are in the hospital now. There are other patients who are there for many reasons, and some of it is deferred care. In other words, people who didn't seek care during COVID who are now, unfortunately, in the hospital as a result of not having had care. So there's multiple factors going into this, and we're working with our healthcare partners to determine what those criteria would mean.
Okay. Well, listen, in our last few minutes, I just want to go around and ask if any of you have any final thoughts or statements. Obviously, we're moving into this next phase of vaccinating our 5 to 11-year-olds, which is very important. And obviously, there's a lot of questions and concerns about there. But Dr. Hauptmann, I'm wondering if you have any final thoughts, and also just to pose the question, will you be planning on doing vaccinations for your younger patients? Will you be offering those?
Yeah, certainly, we're going to be offering them. And I don't know what our policy is going to be, if we're going to have it in our office, which would be so convenient, or if we'll have a central place where families will come. But as you know, there's a bit of a storage problem with the vaccine, with the special freezer. So I would imagine it's going to be like it was for the adults, where There's a central place where you go, but it's still going to be right where our offices are. So hopefully that'll, as everybody's been saying, make there feel like there's a sense of trust and that it's convenient for them to seek the shot where they get their health care. And of course, we're going to be doing it as soon as the FDA meets and authorizes it. In terms of final comment, I would just say that, I know we lots of times have, as parents, we have fear that our kids are different than we are, and they're not just small adults, but they have excellent immune systems, and this shot is being tested to show that, it is effective and safe for them, given their already very good immune systems. And sometimes what really makes a child sick is their overreactive immune system. And so protecting with this vaccine is to protect them against something rare, but when their immune system does overreact, and there is the entity that, everyone has heard about, the multi-system inflammatory syndrome. And, now that we're seeing more COVID at kids, we are seeing more of that. So I think the vaccine is really important to protect our children, and the vaccine is being given at a dose that makes the immune response effective and prevents them from having the disease, which they can sometimes have such a huge immune response that they have a bad outcome.
Yeah, that's great. Thank you very much. Supervisor Corsi, I know you've been hearing a lot from your constituents, no doubt. There's a lot of concern about COVID and vaccinations. Do you have some final thoughts you'd like to share?
Well, I want to say that, I have some concern when I see 40% of parents saying they want to wait and see. At the same time, I think the plan that Casey outlined is good. Go for that 25% first. Look for that next 25% in the next couple of months. People will come along with us on this. We've seen that in the older population, now the teenage population. Once this becomes available, people see the benefits of it. I'm confident that those numbers will change quite a bit. I know that my young grandsons their parents are looking forward to getting them vaccinated very soon. And I hope that everybody takes that route.
Okay, well, thank you very much. We certainly would agree. Casey, thank you for being with us today. Any final thoughts on your end?
No, I just encourage parents, if they have questions, to talk to their doctor, talk to people at school if they can get information from them, because I do see this as a really positive thing we're moving into. And I understand parents may be concerned, and so we need to meet that concern and then move them forward.
That's great. And Dr. Mace, we appreciate your thoughts about green lighting people to go trick-or-treating this year. Just to tell our public, we will be putting out a statement from Dr. Mace very shortly about that. But do you have any other thoughts about how people should plan for the holidays this year in light of where we are with our vaccinations?
Well, I'm certainly hoping as we get more and more people vaccinated that we can get towards more normalcy. So again, the bottom line, as I've been saying all along, is if you haven't been fully vaccinated, please go get your vaccine, whether it's a 2-shot vaccine or the 1-shot J&J. That's going to help us get back to a normal culture, a normal environment, a normal place where we can all be. So yes, please, thank you very much for that.
Okay, well, thank you all for being with us today. We want to remind you that we will be offering a rebroadcast of this in Spanish tomorrow. We will be sharing the same information with our panelists, Spanish-speaking panelists, tomorrow at 4 o'clock. And we invite you all to be back with us again next Wednesday at 4 o'clock for our COVID update. In the meantime, stay safe, everybody, and have a good week. So thank you.